Hello. Good morning and Happy New Year. This is Matthias Goertz and I'm going to share my monthly COVID-19 update with you. To that purpose, I will, as always, share my screen with you. I'll take a moment just to settle in and take a few breaths. You can do likewise. You can meditate on Don Quixote and his windmills, or you can just close your eyes and relax. And slowly open your eyes. I've titled this 2020 a year in pictures. So apart from the just some COVID figures, I will share with you some images. And I'll start with Shakespeare, always a very good place to start. Hamlet. Okay. COVID-19 scenarios, no change. You're very familiar with this image by now. January 2021 is no different than the previous months. We're deep into what we call a fractured world, where the severity of COVID-19 has turned out to be moderate. The effectiveness of the global response to it has turned out to be ineffective. And just to recall and also maybe just clarify, why are we saying the severity of COVID-19 is moderate? In fact, I think what we are in 2021, what we're going to say is that it's trending towards insignificant. As I said before, 100% of us will sooner or later be infected with this virus. And when I say 100%, that's a rounded figure. Surely there will be some individuals who will never be infected by this virus, but they will be a small minority. The percentage of those infected who fall seriously ill with the disease that has been termed or called COVID-19, which is basically pneumonia in most cases, is at present 1% based on the statistics available to me. And it will, over the course of 2021, will drop towards 0%, because this is an assumption on my part. This is a proposition, if you like, or hypothesis, because I assume, like with any common cold viruses, that this virus is per se completely harmless to humans, provided their immune system is fit, which is the case for 99% of the population, or even if it wasn't so fit in the first instance, it has encountered the virus once, and in doing so has learned to handle it well. So even those 1% of us who unfortunately do fall ill in their first encounter are very unlikely to ever fall ill again in any kind of future encounters. And quite hopefully, this will be true whether you had your first encounter, so to speak, naturally, by just getting infected with the actual virus, or whether you had it via vaccination. The vaccination being, in a way, inoculating you with a proxy for the virus that has certain features of the virus relevant to stimulating your immune response without having the potential risks that are associated with the virus for some of us. So in the course of 2021, the percentage of infected people who fall seriously ill with COVID-19 will gradually drop towards zero. It will never be perfectly zero. Again, when I say zero, that's a rounded figure. There will also always be some cases of some people who, for whatever reasons, may still fall ill, even maybe in the second or third or fourth or fifth encounter with the virus. So, but they will be, again, a very small minority. But that's what I mean when I say 0%. It's falling towards 0%, asymptotically approximating or approaching 0%. It will never be exactly 0%. In terms of the percentage of the people who got infected and who subsequently die in conjunction with this infection, the so-called IFR, I've been arguing that it probably today is somewhere between 0.1 and 0.2%. In my model that I'm going to share in a moment, I'm assuming 0.2%, so that's at the higher end of that range. This may actually be a little bit too optimistic. I'll talk about that in a moment, but at the moment I'm sticking to that 0.2% IFR in my model. And this figure will also then drop towards 0%, in line with that previous figure, right? So just as fewer and fewer people will actually get ill, fewer and fewer people will die, right? And again, that will be hopefully, and I'm optimistic, it will not matter whether it's a natural infection or a vaccination. Yeah. So I'm assuming the vaccinations will do their job, basically, which is to mimic the virus and thereby trigger an immune response that prepares the immune system well enough to prevent, not necessarily a reinfection, but to prevent a severe case of illness, right? And therefore prevent death. And that's the key, right? Okay. Just updating the infection calculations in my model. You've seen this chart before, just updated for January. So at an IFR of 0.2%, which I'm now assuming in the model, as of 1st of January, there are about 3.2 billion cases meaning people who have been infected at least once. Some people may already have been infected more than once. Yeah? Those who were infected earlier in March, April, May, by now their degree of protection against reinfection may already be so low that they are susceptible to reinfection. So it's quite plausible that there are now already quite a lot of people who are already going through their second round of infection, but they may not know it. But so the 3.2 billion means first-time infections, right? And I explained previously, I'm calculating that based on an adjusted fatality figure, right? Which I'm going to share on the next slide. So the fatalities drive this, and not the figures published on, for example, Worldometer in terms of registered cases. Not only, I mean, the registered cases are pretty meaningless, as I said before, and now they're even more meaningless now that people are starting to be reinfected, probably, because you could easily, retest a person, and the same person may register twice or thrice in your model, unless you keep track of, oh, that person was already infected previously, and so I shouldn't double count them, right? But I don't think anybody is doing that. So the published figures may already be starting to have some double counting in them, but they are anyways not very useful, as we've said before, because it all depends on how you test, how much you test, where you test, in what circumstances you test, etc. And every country has a different method. So they're all imperfect anyways, and that's cannot be otherwise. You cannot possibly test everybody, and they're imperfect in different ways across countries. So you can't even compare across countries because the imperfections are not the same imperfections. Right? So I'm not using those public case figures. I'm just for the record, for your information, I'm showing the reported cases down here in this orange box. So as of 1st of January, there were about 84 million cases on Worldometer, which is equivalent to about 1.3% penetration of the global population. Remember, my global model excludes China. I explained that before. So the reported cases correspond to approximately 1.3%. The cases I calculate correspond to approximately 52%. So according to my calculations, we are now above 50% penetration. So half of the world's population, excluding China, have by now been infected with SARS-CoV-2. I'm also offering a projection 3 months out. As I said before, these projections are always iffy, right? They will always turn out to be wrong. But we're now about 3 months, meaning about halfway into the seasonal activity, the winter, sort of northern hemisphere winter activity, which is substantial, which makes a difference, so to speak, in terms of the actual infection activity. So we are halfway through that seasonality. We have, in terms of fatalities, we have about 3 more months to go. So after 1st of April, fatalities would naturally start dropping off quite steeply as we can, for example, in a moment we can look at the Swedish figure, which I have, just to the recorded fatalities, which I can share, just to show you how in a country where you have very limited intervention, and that is a northern hemisphere country, in April, roughly, you see the fatalities, really steeply sloping down. Right? So, so the significance of this is that the last 3 months and the coming 3 months, which is January to 1st of April, ought to be somewhat similar, at least insofar as the Northern Hemisphere is concerned. I mean, there are other movements going on. India has been trending down. I don't know really why that is the case, but it could trend up again. We don't know that, right? So there will be other effects that matter. But I'm taking the last 3 months figures now and just projecting them out by another 3 months, simply on the basis of the next 3 months ought to be not so dissimilar to the previous 3 months, okay? Now, what that allows us to do, so that gets us to 71% penetration by 1st of April, by extrapolating the trend of the last 3 months, meaning the first half, extrapolating the first half of the seasonal activity into the second half of the seasonal activity will get us to about 70%. Now, the reason I made this extra effort, if you like, it's not a big effort, but normally I wouldn't project 3 months out, because I wouldn't feel that it would be very meaningful, right? Because there's just too much fluctuations going on. But this time, because of us being halfway through this seasonality, and therefore it's somewhat predictable how the next 3 months will look, I offer this projection, and the reason I do that is because then in the next 3 months, as we track, we can then see or not whether the vaccinations are starting to kick in. As you know, countries have started to vaccinate in December, some countries. Others, I think the majority of countries have not yet started, but are about to start in January or February. And I think the most advanced in terms of vaccination penetration so far is Israel, if I understand correctly from the public information. They say they have already vaccinated 12% of the population. Now, if they are, presumably they are focusing on the most needy first, which would be rational to do. And I think, even though I haven't seen a lot of rationality in the last 12 months, there will be enough rationality, presumably, that they are starting with the elderly and others who have preconditions. So presuming that they do that, and presuming that their population pyramid looks somewhat similar to the European one, and which means about 25% or maybe 30% of the population would, but depending on the precise definition, would fit into that category of people who are at risk or at heightened risk or whatever you want to call that, then 12% in Israel would imply that half of the people who are at risk have already been vaccinated, which is quite amazing. Now they have got their first shot, presumably they need to wait a few weeks until they get their second shot. The first shot may not give you a very high protection. Maybe it's, some people are talking about 50%, some people are saying, no, it's higher. It seems to be dependent on which vaccine you are using and also who you ask. So I don't really know. But a country like Israel, if they are halfway through vaccinating, at least with the first shot, their people at risk, then if other countries follow that pattern reasonably quickly, by the end of January, maybe a bit optimistic, but by February, let's say, we ought to be seeing a real impact from these vaccinations, meaning fatalities ought to be starting to come down. And since my penetration model is driven off fatalities, it would imply that it would show lower infection level as well, even though, strictly speaking, then in the moment where the vaccines really kick in, infection level and fatalities are no longer closely linked. And so my whole model at some point becomes obsolete, right? Which is good news in the sense that we are having the vaccines and I expect them to work. And so fatalities will go down and we will probably really see significantly lower fatalities than we would have seen otherwise without the vaccine. So, but my model happens to be built that way, that it drives infection penetration off fatalities, right? So even if the vaccines do not actually preempt reinfections, they're just protecting you from falling seriously ill, which is enough. But in that case, the fatalities will go down, but infections will not, right? So they will delink. And my model, which is linking them, will no longer really work. But that's perfectly fine, and we'll just discard the model. It will have served its purpose. And in a way, once the fatalities drop off and go away, as I said on the previous slide, eventually they go towards zero. Nobody will care, or nobody should care about these infection rates, right? It will be 100% eventually, and that's what it is, just like all the other common cold coronaviruses. Nobody will care, right? So in that sense, my model will become obsolete anyways. Even if we didn't have the vaccine, it would become obsolete just a little bit later. Right? So that's fine, yeah? But for the next 3 months, it could be interesting to see how we're trending in terms of these infection levels relative to the 70% that I'm calculating, right? If the vaccines have an effect, we ought to start seeing that. If not in January, then I would think maybe at least in February, and then certainly in March, yeah? And so we can compare what I'm going to then track in the next 3 months with what I projected here as of 1st of January. And hopefully what I'm going to calculate over the next 3 months will be significantly below what I'm showing here. And that would be then the impact of the vaccines. So it's a very simplistic way to start measuring the impact of the vaccines. Now, more importantly than for the infection level, really, we need to do that for the fatalities. So let me share the fatalities with you. Let's see, fatality chart update. Again, we have calculated fatalities as of 1st of January, 6.6 million. It's significantly up. The uptrend, we are, as I said, in the middle of the common cold season. That is driving up fatalities. We had some new data, which is becoming increasingly rare, but I did get some new data from Russia. The Russian government officially or publicly saying that their excess mortality this year in 2020 suggests that COVID fatalities may have been 3 times or so higher than reported. Now, I always assumed that they were higher than reported in my model, but 3 times higher is a bit more than I had actually anticipated for Russia. So that is one data point that drives up the number a little bit, but it's not a huge impact because Russia isn't that big. And I had already assumed that the number was bigger than reported, so the difference is big. But that's one of the reasons why it's going up. But the main reason it's going up is because we're in the middle of that cold season. So compared to the reported fatalities, which as of 1st of January per worldometer were 1.8 million. So we have, in my model, I have about a factor of 3.6 times as many. You may recall a couple of months ago, it was about a factor of 4. I think last time it was 3.9 or 3.8 or so. So you can see that factor is coming down a little bit, and that is explained by the common cold season in the Northern Hemisphere. Because at the moment, proportionally, the Northern Hemisphere countries have a bigger impact than the rest of the world, just because of that common cold phenomenon, that seasonality. And because they also happen to be the ones who have the higher IFRs, because they tend to have the higher age profiles, median age, and higher proportion of population that is above 65 years of age, they hit the numbers disproportionately at the moment. And so and they are also the ones who measure fatalities more accurately. So for the Northern Hemisphere countries, the factor is less than average. And so as they're having a bigger proportion, the overall multiplier goes down. So instead of 4 or 3.8, it's now at the moment 3.6. It may go down a little further. And then at the end of the common cold season, you would expect this multiple to potentially go up again for the same reason, right? Now, by that time, as I said, by 1st of April, I expect the vaccinations to have a real impact. And so that will overlay this model in a way, and eventually makes it obsolete, but also it will start really impacting the figures in a way that is no longer, if you like, a more or less natural progression. It's never been fully natural because of all those government interventions, but the vaccination, of course, will then make a really material difference to the figures, and they will no longer be strictly comparable across the timeline. But that's good. It basically means with the beginning of 2021, we are entering a new phase in this development. And with the potential that 2021 will turn out to be a better year than 2020 was for many of us, or at least some of us. It was a terrible year for some of us. So hopefully 2021 will be better, and that's basically thanks to the vaccines having come about quite quickly. So that's sort of the light at the end of the tunnel. If we didn't have the vaccines, then my numbers suggest that we probably would have needed at least a part of another cold season, meaning next winter, next Christmas, we would still be at it, and we would not yet be through. If we had continued with these restrictive policies and of suppressing the virus, we would, without the vaccine, we would still be busy with this next Christmas. So if we allowed the virus to freely float and we encouraged it to freely float. If we didn't close borders, if we didn't do any of those lockdowns, etc., probably in most countries it would be only one seasonal cycle required, maybe a bit more than one, maybe 1 to 2, to get through this. But because of our delay tactics, we are obviously delaying. I mean, we are not postponing. We are prolonging the crisis, the self-declared and self-made crisis. And now the vaccines come in and reverse that delay effect, shortcut the thing. Luckily, right? Luckily also for the governments, because if the vaccines weren't coming now, it would get harder and harder for them to explain what they're doing, even to the majority of people who so far have been, I don't know, believing that religion that our politicians have been preaching. Yeah, so we'll see. So my projected fatalities, 9 million by 1st of April, on the assumptions that there are no vaccines, right? Just extrapolating from the last 3 months, saying the next 3 months, if there was no vaccines, would be similar. And so I'm quite confident in that projection. But then hoping that the vaccines actually do kick in, and then we should see fatality rates clearly below 9 million, right? And so we will be able to, over the next 3 months, to trace that. Okay. The effectiveness of the global response, we've been saying it's ineffective. I'm now, I would like to add, it's trending towards disastrous. Now the viruses, as I said, the vaccines, as I said, may reverse that in some way. We will see. I will talk about that. But at the moment, it's going towards disaster. It's just getting worse before it's getting better, right? Somewhere between 95 and 99% of humanity are probably significantly affected by the state of exception that we've put ourselves into. I talked about that state of exception at length before. With a few exceptions, right? I mean, I think there are some Swedes and some Americans who probably have a more or less normal life. But even for them, they cannot travel where they want to travel, etc. So they even, nobody has really a normal life, unless there are people who, anyways, just live in their local village, and which there may well be some people in maybe especially less developed countries, or even in developed countries, who just say they aren't very impacted. My mother, who's 84, ironically tells me she's not impacted because she stays at home anyway. She can barely walk anywhere. Visitors who help us may wear a mask, which is a good thing, but she doesn't, right? So, and well, she goes shopping occasionally, and then maybe she does wear a mask if it's required, but she basically hasn't changed her lifestyle at all. So ironically, that group of people who we are presuming are most affected by this are actually least affected by it, right? And everybody else, like our children, who we all know have like zero risk from this, they are the most affected. So it's very ironic. So there are people who are not affected by the state of exception simply because their lifestyle is such, like my mother's, that it makes no difference to them what's going on, right? But I would still venture to say 95% or more of the human population are significantly affected by the state of exception that we have created for ourselves. Which means, if you think that there are 7.8 billion of us, and this has been going on since March, so this is 10 months, so 7 billion man years have been severely disrupted by our politics, our responses to the virus. Right? As I said before, the economic costs last year, 2020, were something like $7 trillion lost GDP, and it's and counting, right? Because it continues into 2021. I mean, maybe 2021 will not see as much of an economic loss, because some of this we may be able to regain, but there may be still significant additional losses too. Because many industry sectors presumably will be affected by this for a long time to come, especially those related to mobility. And I think the worst thing is that by creating this precedents, this global precedents, where governments without any good reason, and I've been arguing all along there is no good reason for this, can impose a state of exception. And I think it has two very significant implications. One, we may be in this state of exception for a long time to come, irrespective of whether the fatality of the virus has gone down to zero, right? Because it serves some people in power very well. And on some accounts, we may never go back to what we thought was normal. We may never be able to travel as freely as we were until February 2020, although we were never very free to travel. If you remember the passports, visa, but it's just going to be even worse, right? Our movement, our mobility as human beings will be even more restricted than it was before, and on a sustained basis. This is not going to go away. If you think about the so-called 9/11 event in New York in 2001, because someone crashed a couple of aircraft into some buildings, which is once in a century kind of event, or maybe less than that. Ever since, every single air traveler has spent 20, 30 minutes in security control checks at airports every time they travel. And before COVID, there were about 1 billion or more than 1 billion air trips per year, right? Each of them coming with a 30% or 30-minute or so security check, which is 1 billion times 30 minutes. That's 30 billion minutes lost for nothing, right? Completely wasted time, just because some very smart terrorist realized how easily people can be fooled into doing something that is against their own interest. I mean, the cost is not just time, the cost of these security controls, right? All this equipment, extra staff, billions and billions and billions of dollars every year spent on these security checks that do almost nothing, right? Because it's not going to happen. People will just start dumping airplanes into buildings all the time. In fact, they can just as easily just dump a truck into people on the marketplace, which they have been doing, right? So, which you can do nothing about. So the point is just that you get a so-called hysteresis effect, which is you create something and you can't get rid of it anymore. It takes forever to get rid of it, and I think we will see that with all kinds of travel restrictions, temperature measurements, and masks on board, and I don't know what ideas politicians will come up with to terrorize travelers, but they will, right? And they will be there for a long time to come, because once you put them in place, you don't let go of them. I mean, the cost of those extra security checks at airports, and mind you, they're not being done at, for example, train stations, right? Which would be just as logical, but no, they're not. Or any other, it's just this one thing, as if politicians have to demonstrate that they're doing something, whether it makes sense or not. But the cost of these security checks at airports, billions and billions and billions of dollars every year, if we had invested those in, for example, protecting people from infectious diseases, we would have saved millions of lives. I mean, those people who talk about saving lives, they don't seem to calculate, or they don't seem to think that the value of one life equals the value of another life. So maybe the lives of air travelers are much more valuable than the lives of people who die of infectious diseases. I don't know. So there is something about these measures that are always going to be irrational, knee-jerk. They're just going to be done because, you know, they're being done. Something has to be done, and therefore we're just going to do something, whatever. And the point is just once you do it, it doesn't go away anymore. You kind of get used to it, and it becomes your new normal, right? So all I'm saying is those of us who like to be mobile, maybe in the rest of my lifetime, I may not be able to be as mobile anymore as I was before. And even before, I was often unhappy about the limitations to my mobility. So I'm just going to have to live with a world that is even more restrictive when it comes to my personal choices about mobility. In fact, de facto, we are not able to fully make personal choices about our mobility, right? Because it's all so restricted. And that will continue for a long time to come. And the other effect of this, having created the state of exception once, and mind you, the travel thing is only one element of that. I'm just emphasizing it because maybe it matters to me personally a lot, but there are many other aspects to the state of exception, of course, that are, if anything, even worse. For example, you know, there's now almost no country where you have you know, a functioning sort of rule of law, right? Because the rule of law in almost all countries has been suspended. Now, many countries never have a rule of law anyways, right? It means that you have no chance of being treated justly, right? Because the law is under the control of some governing elites. But in those countries where you did previously have a pretty strong sense that you had a certain degree of legal protection and a certain degree of rule of law independent of the executive, meaning the governments and their various institutions, that is now outside Sweden and maybe some US states and maybe a few other countries, that's gone. There is, in most of the world now, there is basically a lawless state. Because if the constitution of a country is suspended, and the constitutions of almost all countries right now are suspended de facto, not de jure, of course, but de facto, right? They have been suspended. And as long as a government can just simply, with no good reason, suspend the constitution and the basic rights of their citizens, you have entered a state in which there is no rule of law. And this may now remain the new normal for many years to come. I may never experience in my life again a situation where I have at least some inkling of some protection by the law. Right? Because any government can suspend the parliament and can suspend the law. And I've not seen any significant actions by courts, for example, to prevent this from happening. So yeah, so if you ever thought you were living in a world that is to some degree objectively just, and or let's say where justice is somewhat fairly and objectively apportioned, that's gone. And what I'm saying is this may be possibly indefinitely gone, because there are too many interests in keeping it this way. Yeah. Yeah, so we are going, it's not getting the ineffective response of the global response, it's not getting better. It may get worse, at least from what we can see at the moment. I've talked at length about the divergence of outcomes. Remember, I bucketed countries into 4 buckets: normal, back to normal, muddle through, and new normal. You can think of it this way. Normal means adults are being treated like adults. Back to normal means adults are being treated like adults sometimes. Muddle through means adults are being treated like children, and new normal means adults are being treated like cattle. I mean, that's sort of a simple way of thinking about this configuration here. You may think that's grossly unfair and stupid and whatnot. You can have your own views on that. An adult being as someone who decides for themselves where they go, when they go, whether they wear a mask or not. That's an adult, okay? If you don't think so, be my guest. You can think, of course, whatever you like. This is just what I think. So the normal country, Sweden, as I said before, it seems if you have a country like Sweden, not very densely populated, highly educated, fairly disciplined population, probably, I assume, and a very rigorous policy by the government to say, we rely on each and every one of you to do your part and, to be reasonable, keep some social distancing, wear a mask if you feel at risk, or, if you want to show your solidarity and compassion with others, so very rational, very high level of, quality information available, et cetera, et cetera. If you have that kind of a country, it seems that it does take something like 3 years to get through, to herd immunity, to get basically through the infection. So Sweden would still have 2 years to go without the vaccine. Right? That's always without the vaccine. Now, some of the back to normal countries are much closer to getting to herd immunity, and some are already, according to my estimates, already at herd immunity, and I need to talk about those in a moment. Mexico, South Africa, and Iran in my model. So what you see is this can happen much quicker. The virus, if the conditions for the virus are right, it can affect most of the population within 1 year. Yeah. So Sweden, which I call normal, is in that sense maybe not so normal in that it is very highly disciplined and it had a very clear strategy, and people did pull together by and large, and act prudently. Let's put it this way. And it takes 3 years to get through. Whereas maybe in some other countries where government didn't have a clear policy, but they did not maybe make too many impositions either. They just sort of let it be. And I'm not sure whether that is the case in these some of these back to normal countries. I do not know the details of all the policies or lack of policies in those countries. But generally speaking, I feel there seems to be an indication that if you let the virus sort of run, and all countries have some measures, right? They at least at the minimum they try to protect their healthcare system. They hand out some masks. There's some positive, sometimes some very positive actions. So there's no country that has like absolutely no response, right? But those who have a response that is not intervening too much with the actual viral activity, and where maybe population densities are high, and people are quite mobile, and the virus just finds conditions in which it spreads easily. Indications are that those countries can be through this within 1 year. So some countries are coming to that point. And Mexico, South Africa, and Iran, I will talk about on a separate slide in a moment. Russia, as I say, new numbers, somewhat higher than before, and Thailand, I've added. Why? Because I have friends in Thailand, and people keep talking about it having such a low penetration. It does seem to have, from all we know, a low penetration, although not nearly as low as official figures suggest. This is based on BBC, excess mortality figures, which in Thailand are like 42 times higher than the reported COVID figures. So, but with that, still penetration in Thailand appears to be quite low, right? Lower even than in a place like Japan, where it is also pretty low. I put it here because, as you know, I'm not including China, and just simply because I have no data on China, but Thailand has been mimicking, the government of Thailand has been mimicking the strategy of China. That's quite clear to me. And so there's one possibility here is Thailand may be somewhat somewhat exemplary of, or somewhat indicative of what may be the case in China. Yeah. It's not impossible that China does have very low infection levels even today, even though it was the first country to be affected by this, even though Wuhan had very high activity. But if they were able to lock it off effectively from the rest of the country, it is not impossible that China does have a fairly low infection rate. As I'm saying, Thailand apparently does seem to have, right? I mean, there's a lot of caveats because the data is very iffy. And Thailand, remember, was one of the first countries outside China to report cases. So the virus got there relatively early. Now, the virus being somewhere relatively early may be an advantage insofar as they may still be primarily dealing with the Wuhan strain, right? Whereas most of the world by now is dealing with the Italian strain, and now we're starting to, in some places like the UK or Ireland or some other places, Canada perhaps, and the rest of Europe sooner or later for sure, and the US, we're starting to deal with the UK strain, which is quicker to replicate yet, right? So it is possible that some countries that had the virus early and then locked themselves off the rest of the world very effectively, that they're still dealing with the original strain, which was a lot slower. Right? And so Thailand gives us maybe a glimpse of what it may actually be in China. But it may or may not. So I'm trying to be very cautious here. Obviously, China being so large, if my model, I'd love to know what's actually the case in China. But yeah. Whether Thailand is really a good approximation or not, I cannot say for certain. But a country that has such low, slow-moving activity without vaccines would be at this forever, right? I mean, they would be dealing with this for years and years and decades, right? Now that's not going to happen, right? Because they will get the vaccine, and eventually these countries will also go back to some degree of normalcy, be it a new normalcy. So we will see how that will pan out. But the dependency on getting the hands on vaccines vary widely across these countries, as I said before. Right? Some countries are much more dependent on, in order to get back to some sort of normalcy, they're much more dependent on vaccines than others. Some countries like Mexico, South Africa, and Iran may really not depend on that at all, or very little. I mean, they will still benefit from them for sure, but the benefit is much less because most of the fatalities, so to speak, unfortunately, have already occurred. So they're already at the tail end of their fatalities, if my model is correct. Now, one more piece of data I wanted to share, because that is something I hear a lot from people. Oh, Matthias, you're lionizing the Swedes for what they did, and yes, maybe they have some more, individual responsibility than other countries, etc. But didn't they pay dearly for that with excessive fatalities? So that argument I hear a lot, and so I finally got to it. And okay, I'm going to take a snapshot as of 1st of January and say, well, what are the fatalities? And this is excess mortality figures, right? It's the same figures that I'm using in my model, right? Not reported fatalities, but they are scaled up by wherever I have data on excess mortalities. In two of these countries, I don't have good data. I just made a simple assumption, so bear with me on that. But for most of these countries, I actually have decent excess mortality data, right? So, and remember, I'm assuming all excess mortality is linked to COVID. That's just my basic, simplistic assumption. Although some countries, Mexico came out with interesting figures, by the way, and they said, yes, we have those excess mortality figures. It's a factor of 2 point something, I forgot, but only 1.7 of that 2 point something is due to COVID. There are other reasons for the rest, but I always wonder what other reasons, right? My hunch, and the reason I'm sticking to my assumption that all excess mortality is linked to COVID is that, yes, there may well be things such as, people dying, increasingly dying above average deaths from other severe diseases. But my argument is, the reason this year in 2020 more people died of those diseases than in an average year is because of COVID, because COVID crowded them out of the hospital, right? Hospitals allocated beds in intensive care units to COVID patients, even sometimes not using them, but they allocated them. And other patients who are also severely ill and would have needed those treatments or those ICU units couldn't get them and died at a higher ratio than they would have otherwise. So those are indirect fatalities linked to COVID. They're not dying of COVID, but they're dying of, if you like, government policy, or it's not even anybody's fault. I mean, any healthcare system has, at least in the short term, has capacity limits, and that's just what it is. And so some people are dying because of these capacity limits being hit here and there locally in some places, or sometimes, in some cases, maybe bad decisions are being made, but some of those mistakes are honest mistakes, as I said before, and nobody can be blamed for them. It's just, there are these unintended side effects. Maybe we will find there increased suicide rates in parts of the world or whatnot, right? So these things, you may say, they're not directly linked to COVID, but they're indirectly linked to this phenomenon. Yeah, and so my numbers, my fatality numbers include, if you like, fatalities due to poor government decisions. Right? I could almost go as far as saying due to government murder, right? Because some of those decisions are so obviously murderous, you cannot easily excuse them, right? Such as the German government imposing an export restriction on PPE to Italy just when Italy needed it most, right? I mean, that's murder, right? that cannot be excused as that's deliberate killing of people, right? And there are many other cases. I don't want to linger on this, but so my fatality numbers again are including all excess mortality. And if I take those numbers, and it is what it is. I don't have perfect data. The data may not be correct. I'm just doing my best. But based on that data, Sweden's fatalities per capita as of 1st of January, actually slightly below European Union average. So within the European Union that Sweden is a member of, Sweden is actually slightly below average, not above, as many people seem to say or think. And then I just picked a few other countries that are, if you like, culturally, economically, somewhat similar: UK, US, Switzerland, Canada, Norway, and they're not non-EU members. And as you can see, Sweden is sort of stuck in the middle, right? And it's a huge range. Obviously, different government policies do matter, but there are many other factors as well: population densities and just cultural differences. Norwegians are probably famous for being rather distanced from everybody else. So social distancing to them is probably not a difficult thing to do. So anyways, you can see, yes, it's a big range, and some people may say, but if Sweden had pursued a policy like Norway, then their fatalities could have been more closely to those of Norway. Yeah, maybe. But Norway is one of the most restrictive governments anyways in Europe, even outside COVID, and Sweden is not. So, you cannot just isolate one thing from the other, of course. But so these comparisons, as I always say, are always to be taken with a big grain of salt, because countries are different in various ways. But it is simply not borne out by this data that Sweden paid for the protection of basic rights with excess human lives. They didn't. They're stuck on the average with somewhat comparable other countries in terms of fatalities. And they are way ahead of anybody else in terms of protecting basic rights. So, I mean, the message here is, to put it positively, it is perfectly possible to protect basic rights and even leverage the fact that there are basic rights and that people are adults and can take responsibilities for themselves, it is perfectly possible to leverage off that to deal with the virus in a way that is at least as effective as all these other methods. Yeah. So there's nothing here that would suggest that Sweden paid a price for protecting basic rights. They protected basic rights and they got it for free because the fatality is just the same. Yeah. I'll keep tracking this because I'm curious how this evolves. So maybe in 3 months' time or thereabouts, I'll have an update on this. Okay, I was promising you to talk about those 3 countries that, according to my calculation, ought to have hit herd immunity already, but it is not at the moment clear from the data that it's true yet. So there's the possibility that I'm too optimistic about my IFR, that the IFR actually is a bit higher, which would then mean, the penetration with the virus in those countries would not be 80%, it would be somewhat less. But at the moment, I'm not yet changing my model, but I'm alerting you to this. And I'm watching these data now very carefully. And in a month's time, when I give you my next update, hopefully I'll be able to show you how the data, well, not hopefully, for sure, I will be able to show you how the data panned out, right? So what would we expect now? Sweden, being a normal country, you would actually expect, the midpoint of the seasonal activity would be just around Christmas. That's just sort of 3 months in, and then you have another 3 months. If you look at Sweden first, and you look at the left of the graphic, you look at the data from the first sort of seasonality that this virus sort of hit. Remember, the virus arrived in Europe just at the tail end of the cold season last year, right? The 2019/2020 cold season, right? So it peaked, those fatalities, they are delayed by 4 to 6 weeks, but leave that aside for a moment. These fatalities in Sweden peaked somewhere, if you take the brown line here, it's the 7-day average, moving average, somewhere in the sort of in the first half of April, actually, right? I remember Sweden didn't have significant interventions. That's why I'm using Sweden here as a sort of just as a benchmark. Not because I love Sweden so much, but here just because other countries in Europe, the shape of the curve is steeper because of massive interventions by governments, right? Lockdowns, basically, right? In Sweden, you can see naturally that fatality rate at the end of the cold season just tapers off slowly. It doesn't drop so steeply, it tapers off slowly. So I take that Swedish curve as my archetype of the tail end of a seasonal activity. Now, this was not a typical season because the virus only hit at a time when the season was already, 3/4 or 2/3 over. So even that is not necessarily representative of the next season that we are now in, right? But it's the best we have. Swedish data is just the best we have in terms of being an archetype for how at least the tail end of a seasonal activity ought to look. So if that is how it looks, if we look at Sweden's data, and the data here the last few days of December in many countries is skewed because of Christmas, and people don't measure, people, deaths are not accounted for properly. Some of them will be then accounted in the first week of January. So in some places you may see a spike up in January because of that. So, there's also Sweden actually has an accounting that always lacks a little bit. So expect, as they go into the first week of January and update this data, that the curve doesn't drop off. There's no reason in Sweden for this curve to drop off like this in the end of December. There's no reason for that. Right? Rather, what you would expect, and I indicated that with my little red arrow, is that it will probably rise a little further, or maybe it's now just about at the peak, and then it will, as of sort of late March, it would then gently start dropping off again. That's what we would expect, given what we saw in last year's season, at the tail end of last year's season. If we extrapolate from there and say, well, let's expect the same shape of the curve generally to come about again this year, then that's the shape of the curve we would expect. Now, this doesn't assume vaccinations. Now, the vaccinations will then, at some point in January, February, start making that curve come down earlier. So instead of peaking in late March or April, it will hopefully peak, let's say, end of February or so. And that then makes for a real gain in terms of reduction in fatalities. So I'm just putting Sweden here as sort of a mental image, or as a benchmark. Now, Iran was the first country that I projected that it would reach herd immunity. I already said that 3 or 4 months ago, that it was maybe just 3 months away from herd immunity. In Iran, we see a peak of fatalities in November. Means there was probably a peak of infections in maybe early October, because the fatalities always have that 4 to 6 week time lag. And since then, it really has come down steeply. And of course, if they're really at 80% infection rate, as my model projects, then we would expect that curve to continue coming down. So if my model is correct, Iran should basically only see fatalities sort of drop, the 7-day moving average, not on a daily basis. There will always be some spiky days, right, because of counting or accounting, right? But the 7-day moving average, we ought to see just coming down and down and down and towards a fairly low number, not necessarily towards zero, right? Because we are not at 100% penetration, but fatalities just will go down to zero, towards zero, right? In Iran, and the data in Iran at the moment really looks like that, right? So you can see my little extrapolation here with my little red arrow. It just sort of says, yeah, we just continue writing down that curve. So that's my conceptual anticipation. Now let's look at Mexico. Mexico doesn't look so clear-cut at all. Mexico, like Iran, is also in the Northern Hemisphere. Most of it is not tropical, meaning just like we had this seasonality in Iran that got it to the peak in November, if there hadn't been seasonality in Iran, if it was a tropical country, then this curve would be flatter and they would be further away from herd immunity, right? So the seasonality obviously has accelerated it. In Mexico, we see some of that as well. So Mexico, since a low point in mid-October here, has been trending up again, as you can see. And that's presumably because of seasonality, because most of Mexico is Northern Hemisphere non-tropical, so presumably it does have a winter common cold season. Maybe not a very hefty one compared to countries further north, right? But there is some of that probably. Yeah, I haven't double-checked this, so mind you. I mean, I haven't talked to the health ministry in Mexico. Do you have, a common cold season or not? I cannot check on everything, but I think there's no reason to assume why Mexico would not. It is far enough away from the equator, and it's really, other than the Yucatan Peninsula, I think it's not tropical. So there's no real reason to assume they don't have seasonality, right? So, and I think that's what the data bears out. Now, if Mexico is at more than 80% penetration, this number ought to be coming down, I mean, any moment, right? So, and that's where I was saying earlier, well, maybe I'm too optimistic with my IFR. Maybe the IFR is a bit higher than 0.2. Remember, I said my model right now assumes 0.2, right? And I didn't talk about that on the previous slide, but I'm scaling that 0.2, which is the global average, according to demographics. And I've actually updated my model a little bit using no longer median age as the proxy, but I got data from the UN for all countries, proportion of the population above 65 years of age. And that's probably a much better proxy for, what proportion of the population is at risk, and therefore, which translates into an average, IFR for the country, right? So I've now scaled the countries no longer according to median age, which was an so-so proxy, but according to percentage of population above 65 years of age, which is, I think, a much better proxy. It's still a proxy, right? That's all we can do, but it's probably a pretty good proxy. So, which has relatively shifted the relative situation in the different countries that I'm tracking a little bit, but it hasn't had a huge impact. It shouldn't have had a big. I mean, median age that I used before was not a bad proxy, but now I'm using an even better proxy. But that, just as an aside, I forgot to mention on the previous slide, but that's something that I've actually changed in the model, just to be sure that I'm as accurate as I can be. But still, with that change, so Mexico, South Africa, Iran are all countries with fairly low percentages of the population above 65, so therefore the IFRs are all pretty low. And with that, and with my global average assumption being 0.2, and that all the countries then being scaled off that, it comes to those three countries all having infection ratios by now of 80% or higher, meaning by our conventional definition, they have reached herd immunity. So we ought to be seeing a significant drop-off in fatalities. At the moment, we're only seeing that in Iran, and we're not seeing that in Mexico and South Africa. So in Mexico, I mean, I would say we must be just at the cusp, and it's just that Mexico in October, a little later maybe than Iran, was hit by this cold season, and that seasonality really creates like a little wave, right? And even though a country is already near herd immunity, it is an accelerator. The acceleration in a country near herd immunity will be less than in a country that is far away from herd immunity, like the European countries or North America. But and that's what the data bears out. But there's still a bit of that wave, right? So Mexico is now going through that wave, but according to my model, even if we say there's a 4 to 6 week time lag, and what we're seeing here in terms of fatalities is actually the effect of infections that happened a bit earlier. So in other words, what's possible is that we are seeing fatalities peaking right now, but infection levels have already peaked 4 weeks ago, right? Now, if you look at Mexican data and South African data, that's not actually the case from the published data, but the published data is always very iffy because it may just suggest there's more testing, new ways of testing being done because government sees activity because of the seasonality in Mexico, for example, and then go and test more. So that, it's very iffy to look at those published infection numbers. So theoretically, we ought to be at a point where in Mexico, the fatalities are just now peaking, and infections already peaked 4 weeks ago. That's my theory. Now, if that theory holds any water, then we ought to see in January and February a significant sloping down in Mexico. And that's what my little red arrow here indicates. So that's my anticipation for Mexico in the next few weeks. And if that doesn't happen, then my model, then at some point I have to recognize my model isn't working well. Right? Because I've always said the model isn't perfect, but wherever there's data available or that matters, I need to calibrate my model such that it is consistent with any factual data that is available, right? And if Mexico doesn't see a significant drop-off in fatalities in the next few weeks, I will have to revisit my model and, for example, assume that the IFR is not 0.2%, but somewhat higher, the global IFR. Same applies to Africa. South Africa. Now, South Africa is yet another special case. Southern Hemisphere, mind you. So therefore, there should not really be a seasonal, or no significant seasonal activity. It is true that common cold seasons do take place not only during the cold part of the year. There may sometimes be seasonal effects in summers, right? Even in Europe, we know that sometimes there are cold, little smaller cold kind of waves happen in summer. So there is some movement, seasonality in summer, and South Africa right now is, of course, in the middle of summer. So, I mean, there may be a little bit of that, but that would not, I think, explain why in the last few weeks, a couple of months, we've seen a significant increase in fatalities again. Meaning there has been 4 weeks earlier a significant increase in infections. Rather, I think what we're seeing in South Africa is something similar to what we are now seeing in the UK, for example, or in Ireland, which is the emergence of a new strain that moves much faster. So South Africa right now is going through a rather spiky sort of last wave, if my model is right, going through a very spiky last wave that is accelerated, triggered by a new strain that is much more infectious than the previous version. That, to me, is the only rational explanation why South Africa is currently seeing this spikiness of cases and fatalities. Right? Again, if my model is correct. Therefore, we ought to see that spiking up and then very quickly spiking down again. Because again, South Africa is at over 80% infection rate already, according to my numbers, right? So if my numbers are correct, if my model is correct, by correct, I mean roughly correct, right? I mean, it's not going to be perfectly correct, but roughly in the ballpark. If it's in the ballpark, then we ought to be seeing a really quick spike up because of that new strain, and then a spike down in fatalities. Yeah? So Iran, Mexico, and South Africa are all cases I'm going to monitor very closely over the next few weeks and really hope to see that it will look roughly like those arrows that I've drawn here, right? And if it does, it would validate my model. And if it doesn't, it will force me to rethink my model, and at least some of the assumptions, most likely the IFR. Yeah, I will report back in a month, so let's see what happens. Right, looking ahead. Vaccine scenarios, we've talked about this before. We said there are 3 possibilities as of 1st of January. Number 1, the vaccine will be administered, or vaccines, of course, there will be multiple vaccines available, 3 or 4 or 5, or even more coming on, maybe on stream in the next few months. And they will be administered, and they're all somewhat effective and functional in my judgment. So, I don't differentiate them at the moment. I'm not saying, oh, this one is clearly better than that one. Obviously, those that can be transported at plus 8 degrees Celsius are obviously logistically easier than those that require minus 80 degrees or so. But I'm not differentiating the vaccines here. I'm just saying the vaccine, whichever type. And I know they are very different types, and we will learn a lot about how they work differently in the coming months and years. But at the moment, I'm just treating them as one, right? I'm just saying the vaccine is coming. If the vaccine is administered across most countries rapidly to the at-risk cohorts, which typically are somewhere between 15 and 30% of the population, maybe. And if all countries do that, and if we distribute them fairly, and we make sure whether country is rich or poor, every country gets their fair share so that their at-risk cohorts can be served, we could be back into an early spring scenario by July. It is possible. It is still possible. Second possibility, if many governments, maybe not all governments, but many substantial governments aim the vaccine at the entire population, meaning they insist to use the vaccine to reach herd immunity, to artificially reach herd immunity, meaning at least, let's say, 80% of the population having been vaccinated, which is, of course, not really necessary, because even in those countries, some percentage of the population has already herd immunity. I mean, has immunity because they've been infected, but since often we don't know that, strictly speaking, for a country to be sure that they've reached 80% herd immunity, they would have to vaccinate 80% of the population, or nearly, right? Because they don't know who is already maybe immune. In the most cases, where they have the record, oh, this person was tested and they tested positive, so we can assume they have some immunity. Okay, they could then say, oh, we don't need to vaccinate those. They could do that, but those are the minority, as we know, right? Because most people never get tested, even though they were infected. So to get herd immunity through vaccination program, countries will have to reach for something like 80% or nearly 80%, maybe 70% of the population being vaccinated. And if a sufficient number of countries insists on that, saying we insist that we only go back to some degree of normal once we've vaccinated 70 to 80% of our populations, then in July, we will still be very much where we are today in a fractured world, because many countries then will not open up their borders, and they will not go back to some degree of normalcy. They will still be having significant restrictions on people's mobility and so on in place until the point where they've reached their vaccination target, let's say 70 or 80% of the population, which they will not by July. I think it's very unlikely that talking of big countries, that, small countries, yeah, maybe, but small rich countries, maybe. But talking of the global population as a whole, if enough countries insist on using the vaccinations to induce artificial herd immunity, then by July 2021, they will not be done with that. And therefore, the global scenario will still be a fractured world, meaning significant limitations in travel, etc. Mobility, migration, and so on. I said before, there's a third possibility, which is dire, that distribution battles ensue, especially because some countries are so dependent on getting those vaccines in order to sort of start getting back to normal. And that the vaccine then could even induce national conflicts or civil conflicts within nations if there's disagreement about who should get these valuable vaccines first, right? Yeah, and that third possibility, to me at this stage, luckily looks less probable, right? Because it does seem that there will just be sufficient units of vaccination available eventually. It will take a few months and so on, but simply because so far all the front-running candidates have reached satisfactory, even very, very good levels of effectiveness, or have demonstrated those in suitable trials. And regulators have acknowledged that and are starting to approve these front runners. And if the front runners across the board are so effective, as is said, there's no reason why others in the pipeline could not also get there, just with a little bit of time delay. So, in other words, by the middle of this year, sorry, 2021, we may see a deluge of effective vaccinations. Right? So, distribution battles and civil or even national conflicts at this stage, that does not appear very likely to happen. My hunch at the moment is that the most likely of these, vaccine scenarios that I just described is the second one. That there will be a sufficient number of governments around the world who insist on aiming the vaccine at the entire population to reach herd immunity. And by entire population, I mean 70 to 80% perhaps. And not only at the at-risk cohorts, which would be something between 15 and 30%. So, one third or so as many people. So if I believe a sufficient number of countries will behave like this, and therefore the whole world will, in 6 months' time, still be in the fractured world. Now, assuming that to be the case, how does it move from there? I think there is certainly then a follow-on scenario 2A, where if you assume that vaccines actually prevent transmission, because remember, if a country says we are using the vaccines as to reach herd immunity, that presumes that the vaccines prevent transmission, not just illness, but transmission. Right? Otherwise, you can't use them to reach, or you have to drop your target of herd immunity, which is fine, right? If nobody dies anymore, nobody gets seriously ill, herd immunity actually becomes a moot point. But what I'm saying is some governments may not acknowledge that. They may just insist on herd immunity through vaccinations. Now, if those vaccines actually do prevent transmissions, or at least significantly reduce transmissions, then by December this year, I think it's plausible that we might then be in the early spring. So we are taking sort of the detour of vaccinating everybody, or almost everybody. So it takes longer. But by December, we ought to have been able to do that. Now, if the vaccines or some of the vaccines aren't actually preventing transmissions, and these governments do not change tech, and so far we haven't seen any governments learning anything, apparently, or very little, right? So my trust in government's ability to learn is very low at this point, as you can tell. So it's quite possible that we are still in the fractured world in December if a sufficient number of governments says, but we want herd immunity, and we are not getting it because these vaccinations aren't doing the trick. So we stay in our new normal of closed borders and everybody wearing masks and everybody logging themselves in at home or whatever, right? That is not implausible, right? And it all depends on our governments now. It doesn't depend on the virus anymore. The virus is almost now a thing of the past. Going forward, it's all about governments and what they do. Now, and this is quite bleak, if this case 2B arises and governments, a sufficient number of governments of sufficiently large countries, let's put it this way, insist on saying we will not reopen our borders, we will not allow normal mobility until some point in the future where we vaccinated everybody and where the transmission rate has not gone away because the vaccine isn't fully effective in making it go away, but has come down sufficiently to a very low level. Only then will we open up. If that is the case for a sufficiently long period of time, then we could still see that bleak scenario I talked about before, whereby prolonged border closures and prolonged suppression of the virus will precipitate diversification as well as a rise in the IFR, because people just get older, right? So it will push up the IFR just because of the significant delay until when people get infected, if they get infected. Now that will, if all people are by that time vaccinated and the vaccinations do prevent severe illness, that will not happen. So that second part, the rise in IFR at this point looks unlikely, and it doesn't worry me too much. But the diversification of the virus, that, I think that possibility will continue to be there, and it will, if governments act according to 2B, will increase. And we've seen recently the new UK strain, the South Africa strain, which, if I understood correctly, is not exactly the same as the UK strain. It's yet another more aggressive strain. Now, we've talked about this before at length, but viruses do mutate all the time, and there will always be an evolutionary pressure on the virus to become more transmissible. So the emergence of more transmissible, more easily transmitting viruses is not surprising. It's expected, right? But our policies of closing borders and locking people down and minimizing the virus proliferation exerts, in my view, I say this as a philosopher, not as a biologist, in my view, exerts an artificial evolutionary pressure on the virus to mutate into a more transmissional version, even faster than it would otherwise. In other words, we may have, with our policies, we may have created the UK strain, we may have created the South Africa strain, we may have created the Italy strain. Remember a few months ago, it was the Italy strain that was like 10 times faster than the Wuhan strain that sort of excited everybody and that accelerated things in many countries. And today is probably the dominant one. Now it's the UK strain that may be the next dominant one. And that again is, they say, 70% or so faster than the Italian one. So, and by the way, when I give them these names, UK, Italian, Wuhan, I don't mean anything at all in terms of no negativity attached. Those just seem to be the locations where they were first discovered or isolated or reported. That's it. Right? I'm not implying in any way here that that these countries or these locations were at fault, that it happened to be there that this strain first emerged or was first recorded, right? Not at all, right? I'm just, for convenience, calling them those names, right? But without any further, it's just by convenience. There's no other implication. So I call that strain that is now dominant, apparently, at least in the southeast of England, I call it the UK strain, just for convenience, okay? But what I'm saying is that our policies of suppressing and of reducing the mobility of the virus, I mean, remember, by reducing the mobility of humans, we reduce the mobility of the virus, the idea being reduced transmission rates. Yes, but by reducing transmission rates artificially, I'm arguing we are putting artificial evolutionary pressure on the virus to mutate faster, to mutate into more transmissible versions faster. Most mutations don't work for the virus and they never have any effect. Only occasionally does a mutation work for the virus because it makes it even more effective in what it does, which is transmitting itself and then replicating in the cell. So only few mutations are relevant, therefore. They must have an impact, for example, on the phenotype of the virus, right, in order to have any impact at all, which most mutations don't, but some do. All I'm saying is the natural rate of mutation of this virus is what it is, but our policies accelerate that rate of mutation. So the fact that we're getting ever new strains that are getting ever faster is to some degree man-made. It's our policies that make it so. Now, faster transmissibility is not per se a problem. I've always been arguing we will all be infected anyways. Let the thing infect us, right? Let's just protect our vulnerable people effectively, which we haven't done, right? And I talked about that 2 or 3 sessions before, where I laid out what would be an example of the effective measures to protect those at risk, right? Could have been done, but we chose not to do that, or very, very, very limited ways only. Instead, we locked everybody down. Although 99% of the people wouldn't actually, strictly speaking, have to be locked down, but we don't know exactly who they are. So yeah, I've said all of that before, so I don't need to repeat myself here. But the point is we will have an accelerated rate of mutations into ever faster, more transmissible viruses, which is in itself, in my view, not a bad thing. In fact, I even in some way welcome it because it accelerates the whole mess. And hopefully we'll get to the end of this whole mess faster, thanks to the faster transmissibility. What it doesn't do typically, and so far there's no evidence of that, it doesn't make the virus more dangerous, right, thankfully. In fact, I've been arguing long ago that it should make if anything, it should make the virus less dangerous, because the virus has no reason to want to even get into our lung and wreak havoc in our lung. So in an ideal world, these new strains will be more transmissible but less fatal. So that might even be a positive thing, right? But again, it is possible that new strains emerge that are more fatal. It's not very likely because it doesn't really make evolutionary sense. But nature always experiments with all possibilities. Nature is always open to trying out things. Even if I was to say to nature, look, it makes no sense for the virus to kill its host, nature will say, I don't care. I will just let 1,000 flowers bloom and see what happens, right? And unexpected things always happen. And that's how nature evolves, right? And so even if it doesn't seem to be rational, nature will have it so that occasionally a virus strain will emerge that is not only very transmissible, but also more dangerous. That is the risk we are taking. And on top of that, that is so distinct in its phenotype in certain ways that some or all of the current vaccines no longer function on it, right? Or not function well on it. Right? That's the other element. Right? So, yeah, in short, there is still a scenario here if governments remain locked down, remain borders closed, continue to suppress, even as vaccinations go through, that the virus just escapes from all these straitjackets we are putting on it, kind of like a forward, escape into new strains that our measures do not either do not combat effectively or even accelerate. Right? Our measures even accelerate the virus into doing that. And there is still not very likely, but not implausible long-term scenario of things getting worse because we made it so. Right? That's the black scenario. I don't think it's very likely. I said that before, but that it's still plausible and it hasn't gone away. And so far we are not acting in a way that would be inconsistent with this scenario being plausible. Okay, I promised you pictures. So, what happened in 2020? Yeah, number 5 arrived. As you know, we used to have 4 common cold coronaviruses endemic to us, and now we have 5. We also have about 200 other common cold viruses endemic to us. So our common cold virus cocktail has barely changed, actually. That's all that's happened last year. And if we had wanted to, we could have just left it at that. And I'm not advocating we could have done nothing. I'm always advocating we could have done a lot more to protect, knowing early on in March already, knowing early on that it's mostly the elderly and some people with certain preconditions who are affected. And, having always known that the OP masks have some degree of effectiveness, right? Because otherwise they wouldn't be used in OP theaters all over the world. We could have, even in March, had very effective, not 100% effective, but very effective means to protect those at risk. And for the rest of humanity, we could have just continued as normal. We chose not to go that route, but we could have, right? Yeah, my wife always says it looks so cute. Now this is a computer rendering of the virus. I'm not sure it's as cute in real, but I've also really come to to really appreciate this virus. I mean, while my appreciation of humankind has been damaged a little bit over the last year, my appreciation of coronaviruses has definitely gone up. What we're seeing here is nature asserting herself, and to me, that's a good thing. That's a good thing. Now, humanity went crazy, went mad, pulled out the maximum size hammer and hammered down on itself. While the virus is, I guess, if the virus could be laughing, it would now be laughing. And I've talked about the state of exception that we've gotten ourselves into before, so I'll leave it at that. We seem to have humans, I mean, us humans, seem to have reduced our definition of life down to what some philosophers call bare life. You could call it bare survival. It seems that we are now saying all that matters is not to die. Dying is bad. Whether you have a life that is worth living does not seem to come in. Now, some people would say, yeah, if you're dead, Matthias, then you have no option at all to have a good life. So we are keeping the optionalities open for those people to have a decent life. But now we've had an indecent life for 10 months and counting. So I don't know how, where's the point of no return? Or where's the point where this equation that some people seem to be opening there is turned so negative that it becomes ridiculous, right? We've reduced ourselves in some ways to a life form like an amoebian life form, right? That's bare life. This is a single cell organism that just lives. It just survives, multiplies, and survives and multiplies. That's all it does, as far as we know. And that's wonderful. And nature is full of such organisms. But I always thought humans were not one of them. But I think some people think we are just like an amoeba. All we have to do is live, survive, live a bare life of survival, lock ourselves up from life and pray for better days to come or something like that. Right? Now, I don't think that human life can be reduced to bare life. And I don't see myself as an amoeba. And I quite reject the notion that other people can impose this definition of life on me. Now, governments, what did governments do? Well, they set themselves a set of KPIs that, a cow farmer would, right? Treating us like cattle in many ways, right? A cow farmer would also do everything to keep their cows alive because they're valuable to them. They're productive units, right? So they're valuable in dollar terms. Right? So let's keep them all alive. That's all that matters to the cow farmer, right? And I think that's, what our governments set themselves as KPI: minimize fatalities, no matter what. No matter what the cost. Right? In fact, they don't seem to see that there's any cost. They don't seem to think locking us up and taking our rights away and our freedoms away is a cost. They don't seem to even see that cost. Many of them, many of our politicians don't. I think they never knew that we actually, in some countries, actually had rights in the past. I think most politicians don't seem to be aware of that. They're just counting our heads and say, "Oh, we are still, all cows are still there. Good, I've done my job." Yeah, and we went to war, right? We went to war with the virus. Virus is part of nature, as are we actually. We tend to forget that, but we also seem to forget that the virus is part of nature. So basically, this Death Star that you see here in the middle, and we as humans, we're in these little craft here in front, right? And we are flying our attack on the Death Star. And those who know Star Wars, the original Star Wars movie, know what happens. The Death Star explodes, right? They successfully destroy the whole thing, right? Now this Death Star is not coronavirus or SARS-CoV-2. This Death Star is our planet. We are currently flying a massive attack against nature. We are at war with nature. And if we don't pay attention, we may explode the whole thing. The virus is just the tip of the iceberg, right? What happened? Well, we made a lot of category errors. I mean, I've been pointing out two of them. Yeah, the cartoon is just sort of a nice definition of what's a category error. Will you pay the bill? Yes, if you pay for food and drinks. They're talking past each other because their concepts don't resonate with each other. They're making, they're talking about the same thing, but with different terms. It could be the other way around. They're using the same term to talk about different things, right? But those are category errors. So I talked about two of them at least, right? Regularly. One was people mixing up SARS-CoV-2, which is a virus, and COVID-19, which is a disease that may, in some cases, arise from an infection with SARS-CoV-2, right? A lot of people to this day equate the two. On my local channel, certainly they still do to this day. Right? The other more important category error still is people defining the problem to be the virus, right? Where clearly the problem isn't the virus. The virus is unproblematic. The problem is our immune systems and all the stuff that goes with it. Our, aging, our lifestyles, right? Our living a life in which our immune systems are no longer fully functioning, right? Because we make it so, right? So that's the actual problem, right? The virus is harmless. Right? So that's actually the worst category error, is that people to this day talk about we must fight the virus. No, no, we have to deal with our immune systems. Yes, we can protect ourselves. That's only human to say it. If I can't strengthen my immune system, then let me protect it by wearing a mask or, of course, vaccination when it comes, take it. Yes, we have every right to protect us. I'm not denying that at all. And all I'm saying is it would help to actually define the problem first and define it properly before you start acting. I think what our governments all did, or almost all, was acting without knowing what they were acting upon and without even making an effort to define the problem. Oh, virus, let's destroy the virus. Yeah, it's if you define the problem wrongly, then your response is not likely to be effective, right? So no wonder we have what we call an ineffective global response to the virus, because actually it isn't a response to the virus we needed. We needed a response to a situation where we realize that a certain percentage, 1% of the global population, is living with an immune system that has difficulties dealing with a novel common cold coronavirus. That's what we've learned, and that's what we could be acting upon, and could have been acting upon early on. Not just, I'm not saying this retroactively now, right? I've been saying this for 6 months or more. Yeah. So we made these category errors, not defining the problem or the situation correctly, and surprise, our actions are completely met. No surprise. Right? Yeah, what else happened? You've seen this, those who've seen my previous videos. Xi Jinping did his magic. On 10th of March, he went to Wuhan, raised his hand and said, virus stop in midair. And lo and behold, the virus in China stopped in midair. It's magical. Of course, the virus didn't stop in midair, but what Xi Jinping achieved was this fantastic, I mean, from his point of view, fantastic balance between fear on the one hand side and trust and faith in the government being able to handle this uneasy truce with the virus. And Xi Jinping's stature probably grew significantly with that gesture that he made, right? So, the message being to all politicians, if you want to stay in power and consolidate your power, you must lie to the people, right? And one person who apparently didn't hear that message was Trump. He said the truth. He came out of the hospital and said, "Look, I'm fine. The virus is what it is. I learned a lot about the virus. I'm feeling good, and don't allow the virus to dominate your life." That's what he said, right? And I mean, that was one of the most rational statements of any politician I heard about this situation. And lo and behold, he gets voted out of office, right? Because he said the truth. Don't do that, damn it. So no, you have to have the Xi Jinping magic in order to be successful as a politician. Meaning, this is not just to blame those politicians. They are, after all, only humans. As I said before, they are only the tip of the iceberg. They are only representatives of the people. It is the people who want it this way, right? It is the people who want to believe what the politicians tell them. They thereby encourage the politicians to tell them what they want to hear. It's all of us, right? That are ultimately responsible for what we do. We had a year of, lots of fake news. You remember this? Let me move myself here so you can see this is also Trump. This was when he was tested positive for SARS-CoV-2, and the BBC reported President Trump test positive for COVID-19. And as I just said, that's a category error. It's fake news. And my local channel to this day talks about, so and so many people in this country tested positive for COVID-19. No, you can't test positive for COVID-19. That's not possible. That's all fake news. And we have been inundated, in my view, with more fake news this year, 2020, than in any year ever before, as far as I can tell. I mean, 9/11, that year was bad, full of fake news there. But 2020, I think this was a world record in fake news, and almost all of this fake news produced by governments or government-linked news channels. Just to be very clear. Yeah? Of course, there's also privately generated fake news, no doubt, on social networks and whatnot. But no, governments still have almost a monopoly on fake news, at least the fake news that is widely accessible to the population. 99% of all fake news accessible to the population is probably government produced. Right? So this private fake news thingy is that the governments like to hammer on is very small, right, compared to what the governments do. It's the same with like the war on terror. Remember, I mean, 9/11 among other things, led to the so-called war on terror. But private terror, meaning non-state terror, is a tiny, tiny fraction of all terror. Almost all terror in the world is conducted by governments. But they have come up with a very smart definition of terror, which excludes government actors. So government actors, by that definition, cannot, by definition, commit terrorist acts, which is very smart because 99.9% of all terrorist acts are actually committed by government. So all the time, right, against their own people usually, and sometimes against the neighboring people, but mostly against their own people. Be it as it may, so it's been a record year for fake news. Wonderful, and it continues into 2021. I mean, it doesn't seem as if reporters ever learn or say, okay, let me at least call the thing by its real name, right? I mean, that would be at least a start if you want to have something like a rational conversation. The first thing you do is you give the thing a name, and then you actually stick to that name. Yeah. So the thing that you're testing positive for is called SARS-CoV-2. And although I don't like that name, as I said before, because it's too close to the SARS-CoV-1, where those two viruses are actually very different in their behavior. But okay, that's another story. But whatever name you agree on, let it be SARS-CoV-2 if you will, then please use it. Right? And if you're talking about someone who is is hospitalized with illness, then maybe COVID-19 maybe makes sense. As I said, I'm not sure it does because it's just another pneumonia, but that's yet another question. But you agree on a term for it and then you use it. Right? I think that is sort of the minimum, the absolute bare minimum we could expect from our reporters. Okay. Another observation is, in some ways, we seem to be in this uncanny valley kind of situation. Now, the uncanny valley is an idea, a concept by a Japanese, Mori-san, a Japanese professor of robotics, who made an observation empirically, somewhat doubtful actually, apparently, but it's stuck because it's such a nice image and I like the image. He made an observation. He says that people have an affinity with machines that generally increases towards the level of affinity we would have with a healthy person, as the human likeness of that object increases. So the x-axis here, the human likeness goes up to 100%. 100% means it's a healthy person, and 1% means it's a glass of water. Okay, not very high likeness to human. And then on the y-axis is affinity. He used the Japanese term or concept of affinity, but the English rendering is affinity. So generally, as a robot becomes more human-like, our affinity tends to go up, but when it comes quite close to resembling a human, such as this robot here on this photograph, the affinity drops, steep drop, and turns negative. We are disgusted. So there's something in our psyche where, if a robot is clearly a robot, but it looks a bit human, then we find it cute. And the more it resembles human behavior, the cuter we find it, up to a certain point, and then it turns negative because it gets uncanny. It gets uncannily close to human, but it still isn't quite human. Right? It's too close to be cute, and not close enough to be recognized as a real human. And that's what this phenomenon, this area in which our affinity to that piece of technology turns negative, he called the uncanny valley. And I like the term because it is there's something uncanny about, I think, about a robot that becomes, android basically, that becomes very human-like, right? And you are not sure, in the first moment you're not even sure, is this human or is this a robot? Right? So why am I saying we fell, in 2020, we fell into an uncanny valley? First of all, I thought of it in this way. In terms of science and technology, I think we are now really in this uncanny valley situation where our science and technology is so good that we can almost master whatever challenges nature throws at us, but not quite. But at the same time, it blinds us to the fact that we actually don't master nature and that the science is actually imperfect. And so it turns negative in that it creates maybe a kind of a hubris or a kind of a negligence on our part, where we think, we'll just throw science and technology at the problem and it will fix it, right? But actually, in the first instance, it makes things worse, and I think that's what we've seen this year. See, 100 years ago, I think I said that before, 100 years ago, if this coronavirus number 5 had come our way 100 years earlier, where we, A, did not yet know that viruses even existed. We knew bacteria, but we didn't yet know viruses. B, infectious diseases were very common. Therefore, C, few people survived to a very high age, because sooner or later the immune system started deteriorating and they would succumb to some infectious disease or another. So if this coronavirus had appeared on Earth 100 years ago, we might not even have noticed. Or maybe we might have noticed that in that given year, somewhat more people died of infections, pneumonia, let's say, or sepsis, than in an average year. Maybe we would have noticed, oh, this flu season this year is particularly bad. People might have said that, but that's it. And they would not have seen any need, if they had even noticed the new virus at all, they would not have seen any need to react to it. Because dying of an infectious disease was the standard way of dying. And so your immune system eventually goes down and then you die sooner or later, something hits you. And one more virus coming out that can hit you would not have moved the needle very much, maybe a little bit, right? So either they wouldn't have noticed at all, or they would have noticed, oh, quite a lot of fatalities this year from infectious diseases. Yeah, the flu season is really bad this year, but that's it. That's it, right? And there would have been no further action taken. So now we are, this year, 2020, we were in the tricky, uncanny situation where we know that viruses exist. We were very able to isolate the virus, this particular new virus, very quickly, to define it, to analyze the DNA, to create a PCR test, to test for it, et cetera, and we are at the same time so organized politically that we can just close borders, we can just force people to lock themselves up, et cetera, and we can enforce all of these things almost 100%. So our whole technology, science, and social and political institutional framework is such that we can massively react. We can, first of all, know there is something there, and we can then massively act on it. And that's the problem. We are obviously not quite smart enough yet to act rationally. So yes, we can act because we can identify there's a virus and we have measures to take. And we have taken all kinds of measures in this year, but they weren't very effective. In fact, most of them were counterproductive and ineffective. So we are in this uncanny valley where we have all the science and technology, this knowledge and these institutional knowledge and power at hand to act, but we're not yet at a point where we are able to really understand the situation, apparently, and act accordingly. As I said in the previous slide, we define the problem wrongly to start with, right? So that's what I mean by we seem to be in this uncanny valley of technology and science and knowledge. We know ever more about the world and it empowers us to act. But apparently we are not yet at a level of, call it wisdom, if you like, where we act rationally, plausibly, logically, thoughtfully, and yeah, based on wisdom. We have all this knowledge, but we don't have the wisdom required to use that knowledge well. And that's sort of the observation. And I, when I thought about it, I thought of this uncanny valley picture here. We're in that deep valley of, we know more than is actually good for us. And at the same time, we are not yet at a level of thoughtfulness or wisdom to handle that knowledge. And that's a very potentially dangerous place to be in for humanity. That's my observation, anyways, based on what we did in the last year. Yeah, I saw this image somewhere, and I love the image, so I thought I'd bring it to you. So you see here a human skull, this very much enlarged image of SARS-CoV-2 inside the skull, so instead of the brain. And I just wanted to show this to you a bit as a joke. Actually, the article was about, I think, how the corona situation, meaning the man-made policy situation, affects us psychologically, because of course it does affect us, humanity, very much psychologically. And it will take many years for us to fully understand what it did to us, what we did to ourselves in this year, right? But of course, there is no suggestion in that article that actually our brain was, physically changed by this, right? But maybe it was, who knows? Yeah, because it was rewired. It's plastic, right? And it was our brain is plastic, and it rewires all the time. So who knows whether maybe it was physically rewired this year. So I just thought I'd bring this to you as maybe as a half joke and half serious kind of thing. And you thought that the virus only affects our lungs? Maybe more than that. I think again, maybe it's done something to our brains that we don't quite understand yet. And this is another one I shared before, but I love it so much. Did you ever stop to think and forget to start again? In 2020, we stopped thinking. And here's another one. This is a Christmassy one. Huh? My Christmas round robin letter is much shorter this year, says the old gentleman here, sitting at home typing. We went nowhere and did nothing. Yeah, this is probably during the Christmas lockdown in the UK or in somewhere in the US. I don't know where the cartoon came from, but it's very funny. But the reality is, in 2020, by and large, we went nowhere. In fact, I've been arguing we went backwards, right? Last time I had this cartoon of Homo sapiens sort of turning this conventional evolutionary thingy with you have the pre-hominid and then the early hominid, and then ultimately you have the Cro-Magnon man, which is us, right? And normally the evolution always goes like that way, right? Ever increasing, smartness. That cartoon, remember, had humans turn around and say, oops, I'm going the wrong way. I like that one too. Yeah, we went nowhere and maybe even backwards. Now the vaccine demonstrate that humans are always ingenious and we always find something, and that's great. Yeah. I mean, I love the fact that we do find ways to help ourselves, and it does suggest humans are not about to die out, right? But a lot of things went very wrong, were done very poorly, and will stay with us, unfortunately, for a long time to come. So what's my peak preview for 2021? Yeah, a new normal, and we already know I love this movie, The Matrix. It's a bit implausible because in the movie it's machines that create the new normal, what Baudrillard called the desert of the real, right? Which is this actor here quotes Baudrillard when he says, "Welcome to the desert of the real." But the desert of the real is basically a big computer simulation in which humans are made to believe they live like human beings, where in fact that they're being used as sources of energy by machines. Now, this is pretty implausible, I think. And I'm not advocating any view that robots and AI will take over the world and turn us into their batteries. I'm not saying that. I'm saying it's humans themselves who create the desert of the real for themselves, which I think is rather worse. I mean, if it was at least machines who did this to us, we would say, okay, we have to rise up and defend ourselves or something, right? But it is not something external to us. It's ourselves. We are doing this to ourselves. I think that's a lot worse. It's a kind of a cannibalism. we're not being eaten by lions, we're eating ourselves. We're eating our freedoms. Now, I think we'll see a lot of government bootstrapping. This is Munchausen, the Baron of Lies, you know, a famous popular story. He tells stories that are all like obvious bland lies, but nevertheless, they are fun stories. And in one of the stories, he tells us how, you know, he rode his horse and they sank into some kind of a mud or morass or what have you thing, and they got stuck. And his horse was unable to get out. And so he took himself by his own ponytail. In those days, you know, men wore ponytails, and this is apparently not a wig. Could have been. So it's real hair, and pulls himself out of that morass by his own hair. That's a wonderful image of bootstrapping. And that's what governments are going to do this year with the help of the vaccine. They will be using the vaccine to pull themselves out of the madness that they've created, because it's their only excuse for, you know, locking us all up and destroying all our rights, right? Is to say, look, we knew the vaccine was coming, and by waiting for the vaccine, it was worth it because we will have saved lives, right? So they will rationalize their irrational actions with the help of an almost irrational use of the vaccine, right? I mean, all the vaccine does is, you know, what it does, right? But the government, it's like the new panacea, or like the holy grail, right? Governments will be using this as a holy grail to convey a message to us that they did the right thing. And they will be very successful. I'm calling this out not because I think it will fail. No, I'm calling this out because it will work wonderfully and most people will not notice. Maybe you believe in the Munchausen stories as well. So, yeah, you can believe, of course, you're free to believe what you like. I mean, if you just stop trampling on my freedom, you can do with your own freedom whatever you want. Yeah. Okay, what else are we going to expect in 2021 and beyond? I had a similar chart before. It's a slight update. I said before that ever more humans, as we get ever older as societies, ever more of us will live with compromised immune systems. So the key driver of what happened last year, which is our compromised immune systems, that will just get worse, right? No, it's ceteris paribus insofar as maybe having learned something, maybe some of us having learned something, maybe we'll say, oh, maybe we need to put an eye on our immune systems more, given that we are aging, right? Maybe there are things we can do to strengthen our immune systems, right? I would argue, yes, we can, which is expose ourselves to new viruses. That's the best way to strengthen your immune system. But yeah, maybe people come up with other ideas because they're fearful, don't trust their immune systems. I trust my immune system, but apparently a lot of people don't trust their immune system. So, okay, then let them come up with something else. But so maybe there will be things we can invent to strengthen our immune system, but the trend is very clear. We're getting older and older on average across the world, and therefore our immune systems will tend to become ever more compromised. So next time a harmless common cold coronavirus comes our way, there will be an even higher proportion of population who will have trouble. Right? That's the first observation. Second observation was ever more viruses will jump from mammals to humans. These are viruses, they come from mammals. Humans are genetically, of course, very close to mammals, and the virus, more often than not, finds it's possible to jump over. And the more, as I said before, the more of the global biomass we ourselves as human, our bodies take up, and thereby crowding out other forms of biomass, including, for example, a lot of wild animals, wild mammals. I mean, this virus, one theory is that it came from bats, right, or from other wild animals, mammals, which is quite plausible. the more we push those wild mammals into the remotest corners and push them away and replace the space that they previously lived in and populated with ourselves, of course, the more these viruses who are currently living, let's say, on bats, will have an incentive or even a pressure, not just an incentive, but a vital need to jump over to us. So the more we expand ourselves, the more this will happen. Right? So we'll have ever more compromised immune systems while having ever more attempts by viruses to jump over to us. So what I'm saying is what we experienced last year, it will happen not only again and again, but it will happen ever more frequently. Right? Third, and this is where I edited a little bit, viruses will mutate at ever higher frequency. Yeah. Last time I already said, because of our tendency to depend on cattle, which are also mammals, right, and living near to those cattle, and these cattle, or in this case it was minks, it's not cattle, but minks, as so domesticated animal, or animals that are being herded by humans for human purposes. Let's put it this way: the minks, obviously, for their fur. So animal husbandry of all forms. It serves as an accelerator because the virus can jump from a wild animal to us, from us to one of these domesticated mammals, and from that domesticated mammal back to us. Right? So it creates an acceleration loop, and every time it does that, there will be mutations. It's like an accelerator for mutations. And the other thing that I added is what I said earlier. And I think the UK and the South Africa strain, and probably the Italian strain also already, they're all probably examples of this, so possibly they are examples, not necessarily, but there could be examples of this, is our clamping down on viruses whenever they appear will just artificially induce further selection pressure on them to mutate faster and become more transmissible faster. So these three things taken together suggest we will be exposed to ever more novel viruses, ever more frequently. We will be ever less well prepared for them, and we will do ever more to accelerate their diversification if we don't pay attention. So we will just keep making things worse for ourselves if we continue the way we are currently acting. And what I said here, we cannot afford the sort of terrible two toddler type fits of madness that we showed this year every time this happens. I mean, are we going to repeat this whole mess again next time when the virus comes our way? Are we? I hope not, but I'm not sure. Now, this coronavirus, SARS-CoV-2, how about our friend? Well, I found this cartoon. No, you should not get ready to ascend the throne. It's just a head cold, he says, the king. I'm just having a common cold. And, I thought that was fitting because by the end of this year, we may be in a situation, if things go well, where people say, huh, coronavirus? What was that again? Because it will have just become another part of our common cold cocktail that nobody cares about. Right? So that's the irony of it, right? We will have created all these potentially durable interventions in our freedoms and our rights, our way of living, because of the coronavirus that very soon will have become completely invisible to us and irrelevant. We will have even forgotten, what was that again about? Yeah, but the measures we took, they will remain with us much longer. And therefore, there is something about humankind that resembles, my favorite movie, The Matrix. If we don't pay attention, we will reduce ourselves to, remember the movie? Something like this. We'll just become productive units for other humans. No machines involved, I don't think. So it's not the same scenario as in the movie. It's mankind turning mankind into a productive unit and nothing more than that. And with that, I complete my discussion, quoting John Maynard Keynes. Of course, he was speaking in a completely different context, the monetary system, but it is still very true what he said. In the long run, we are all dead. And sometimes I feel, well, thank God it is that way. And with that, have a great time and talk to you in a month.